Are you wondering how to become trained in ketamine assisted psychotherapy? Are you wondering about this? Well, if so, you're in luck because I've got two experts with me today. I'm joined by Dr. Signi Goldman and Dr. Sandra Newis, who run Living Medicine Institute, training programs for a career in ketamine assisted psychotherapy. So I know you as Sandy and Signi. And
hmm
thank you so much for joining me today with this.
Thank you for having us.
Yeah. Well, Dr. Signi Goldman is a board certified psychiatrist and psychotherapist in private practice. She's a certified provider for psychedelic assisted therapies and research through the California Institute of Integral Studies. She's completed training through the Multidisciplinary Association for Psychedelic Study, known as MAPS. And Dr. Goldman has extensive knowledge of research-based use of psychedelics in medicine and co-directs Concierge Medicine and Psychiatry, the longest-running ketamine clinic in the southeastern United States. And
Mm.
Dr. Sandy Newis is a licensed psychologist with over 25 years of clinical experience. She's a highly experienced psychedelic-assisted psychotherapist, specializes in anxiety, chronic stress, trauma, and recovery. She's provided ketamine assisted psychotherapy through concierge medicine and psychiatry since 2019 and brings a deeply trauma informed and resiliency focused approach to the work. And my name's Eddie, and Margaret and I are a Mindful Emergence, where we offer mindfulness, movement, and breathing practices for your healing and personal transformation. And most of our work now is with intentional use of plant medicines. So, talk about you blend the ancient and modern sciences of altered states for healing. Signy, tell us about Living Medicine Institute, your mission, your vision, please.
Yeah, thank you. Thank you for inviting us and for asking. So we run a training program for licensed providers that can be therapists or medical professionals of different types who want to get into the sort of legal practice of psychedelic medicine in clinical settings. So that's a kind of a specific niche, right? There's a lot of amazing trainings and a lot of work being done in other kinds of niches in this world. But we serve that niche of people who are already licensed professionals, already run a practice or a part of a clinic, and they want to incorporate like safe, effective use of psychedelics. And obviously, that's not an easy transition. Our traditional training programs, whether you're a therapist or a physician or other medical provider, don't teach the things that you need to know to do this kind of work. It's a huge paradigm shift. And so we sort of fill that niche of people wanting to know, how do I become someone who knows how to do this and I can do it well? And we do focus on the use of ketamine really because that's our legal one, right? And that's the one that most of the people who come through our training program are going to be using at least in the near future. And so we're very much about launching people into practice quickly and getting them going right away. And so ketamine is the vehicle that we can use for that. And Sandy and I have a lot of respect for ketamine's psychedelic properties. You know, we've done a lot of ketamine sessions, and so we've sort of used that background to sort of inspire or influence the curriculum. And one thing I will say is that we have a big emphasis on being on the medicine a lot or experiencing an altered state a lot before you step into doing it for other people. So that's a big part of our program. And
Mhm.
then we also teach sort of active psychotherapy while someone's in the altered state. So those are some of the reasons people come to us. And so, yeah, we run training retreats and also sort of longitudinal clinical intensives in this work. And it's just an honor and privilege to do that. So
And I should point out you're based in Asheville, North Carolina.
we are, most of our trainees at this point come from other states, even other countries, because a lot of what we offer is sort of a mixed format, some online, virtual, teaching and lecture style, and then some participatory experiential pieces that are mixed in. And so some of our trainees come from this region. We are based in Asheville, like you. And then others will be coming from further away, but they'll partner with ketamine clinics near them to do the experiential parts to make it more affordable or more accessible. So these days, our cohorts are really a mix. We've even got people coming from other countries. And so it's really gratifying. It's exciting to do.
And Sandy, we met at a party. I don't know if you remember. This was probably 12, 13 years ago. and you were working in wilderness therapy or had been, and your background, as I knew you, was primarily in addiction recovery. And now you're doing this work. Talk about that transition. Why now? Why you?
Oh, nice. I have really spent my entire career working in novel experientially oriented interventions that really have a non-ordinary state component. So outdoor based nature connection, outdoor based experiential types of therapeutic settings for addiction recovery, as well as trauma, which I consider those things to be inextricably linked. So you would say I would specialize in addiction recovery. I'd say I was specializing in trauma while working in addiction recovery, which may be semantics, but it kind of shows where the emphasis is. And really every single one of those things is ultimately about shifting and recalibrating the nervous system, and then how that impacts our capacity to function in relationships, in our life, and our perceptions of the world, and our ability to feel safe. So really, my whole career has been about the exploration of non-ordinary states in novel experiential interventions. So this to me is a logical progression with that. It's also super mission driven for me. I really believe in non-ordinary state work and psychedelics fitting in with that. So it's really been something that I've been drawn to really my entire adult life. And I've been following the threads of the research, and but not just in psychedelics, like how that's informed by mindfulness, how that's informed by nature connection, how that's informed by spiritual practice, how that's informed by somatic and brain-based approaches to working with psychotherapy. So I'm really about the integration. So there's a lot of reasons that have led me to this, and where we stand right now in my own self and with living medicine is really working that integration piece. And that's a big piece of what we teach and offer. And it matters to me because that's what's really made a huge difference for me as a person and as a professional.
Well, and as a person in long-term recovery who also has experience working in these expanded states, for me, it's seamless. It really does fit very well. So, Signi, in your work, when people come to your training, what can they expect? And what is the ideal trainee? What kind of attitude? What is there such a thing as
Hmm.
like,
Yeah,
okay,
that's a
these
great
are the kind of
question.
people that are really best to work with?
Yeah, that's a great question. I mentioned already that we work with people who are already licensed providers. There's a lot that could probably be said there. But outside of that, we actually prefer to take people who first have some humility, that they still have a lot to learn and are willing to do their own work, if that makes sense.
Oh
In
yeah.
other words, just because someone looks like they have credentials on paper doesn't mean that they can safely hold this kind of vulnerable container for other people. So usually we're looking for people who really are, have a reverence and respect for the work and a willingness to do their own kind of shadow work, to work with their own stuff. Really, we say that getting trained in this work is an initiatory experience. Like it's going to change you as a provider. And so you're going to be doing a lot of your own medicine work while you're getting trained. And so it's a transformative process, and you have to show up for that process with humility and just in respect for it, for the work. And so just as, one thing that we look for is people who can show up in that way. And we, we look for people who are willing and interested in what we call developing a relationship with the medicine. And I know that comes from a world that you're familiar with, but with ketamine, we think that's equally the case. Getting to know what it feels like, getting to know yourself on it. And so we have a real emphasis on doing a lot of medicine work in order to do that. And so our trainees come in with that expectation and an appreciation for why that piece is in there. And then we tend to attract people who really want kind of nuts and bolts how-to skills, like, okay, what do I actually do once the person has taken the ketamine, and then what do you do, and then what do you do, and have a lot of modeling and examples of that. So, we're looking for those people, that people with ethics and that have the right kind of have done enough of their own work. Someone like yourself, right, has had their own journey, and so that they know how to show up in a there's this, and something that you I think will understand, but there's a certain attitude of respect for the medicine and the medicine space that some people just know how to, are ready to learn, or are available for. And if you're not that kind of a person, or you're not at that place in your own personal process, then from a mentoring point of view, we may say that you're not really ready. Right?
People ask me about various medicines and how do I know if I should do this, if I should do that? And my answer is if you're supposed to do it, you'll know. I
Yeah,
really believe these medicines call us in, especially the plant medicines. So here we go again. I'm out of focus, but doesn't matter.
you're out of focus, but maybe, yeah, it's meant to be. We can hear you great.
As long as
Yeah.
I'm not the most important part of this.
Well, I like what you said. I do think there's something about being called to this. And
Mhm.
that's actually a little bit of a better way of saying it than what I said. So, in
Mm.
a way, Sandy and I are looking for people who are called to this and not just they want to do it because it's cool, but they are called to it and their life up to this point has prepared them to be ready in some ways, right? In the sense of sort of like psychological, emotional maturity, willingness to look at your own stuff. And then we as a staff team, Sandy and I and our staff team, we hold that standard for ourselves as well, like looking at our own stuff and tracking our own, and so it's something that's not talked about that often when people talk about training programs, but it's important that there's a certain vetting on that level that's happening.
Absolutely.
I would
So,
love to add a
yeah,
little bit
please,
to that.
Sandy.
It's really people who are also really looking to bridge the gap between I'm feeling this call, I want to do this work, and I don't know how to get there. So we're trying to kind of provide a direct route of like, what Signi said, like, are you doing your own work? Have you done your own work? Can you show up? Because it's really important with psychedelics to show up in a grounded, authentic place because it's very energetically sensitive and it's very relational. And so to kind of be able to move into that work while also providing kind of a direct path. Here's what you can do. Here's some skills. Here's some approaches. And when you come through it, like you'll actually be, are ready to see clients. So really kind of meeting that direct need as well.
So there's such a thing as ketamine treatment, which you offer at Concierge, and then there's ketamine assisted psychotherapy. Sandy, could you break down the distinction between these two? Because there is one, right?
Sure. Yeah, it's super important that people understand that because it's a new field and it's kind of dynamic and ever evolving. So there's a lot of different terms that are utilized. So that is in and of itself becomes a point of confusion. So really there are two tracks. There's ketamine alone, and then there's ketamine assisted psychotherapy. And that's not just in our clinic, that's kind of consistent across the board. And some places only do ketamine, and some places do ketamine and cap, which is what we call it, and which is what we do. But ketamine therapy, ketamine treatment, um, ketamine, ketamine work, ketamine therapy, like all of those different things are kind of used interchangeably. So we can say ketamine assisted psychotherapy is one thing, but within that, you might also get language that might just be ketamine alone or even be ketamine assisted psychotherapy. So it can be really difficult. So that's a question for people to just know when they're vetting a clinic. So ketamine treatment alone is when a client goes in and works with the medical provider, a prescriber. They have varying backgrounds. It could be an anesthesiologist, ER doc, nurse practitioner. There is no requirement for mental health education or even awareness within that. And they might do an IV session, intravenous or intramuscular, sit in a chair, listen to music, generally have eye shades on and a blanket, and you're really having mostly an alone experience. You are tended to by the medical provider. And there rarely is much preparation other than a medical screen, and there rarely is any integration, any follow-up. So that is primarily a pharmaceutical intervention and an experiential intervention. So experiential meaning a person might have their own experience, but what you do with that kind of is up to you. And people have good results with that. Sometimes those clinics pay a great deal of attention to set and setting and the importance of client experience, and sometimes they don't because it's totally unregulated. Um,
Call
and
those
then,
pump and dump.
well, it can be,
Yeah.
right? It can be very lucrative. You can be run kind of like a nail salon with people in at 15-minute increments. Or it can be done with a tremendous amount of care to patient experience. And those are things for people just to know because people do have positive effects with that.
Mhm.
Ketamine is a powerful pharmaceutical intervention. It's just we wonder, and then we try to layer in what has happened in the field is layering in the psychotherapy piece in order to extend and deepen the therapeutic benefit. So ketamine assisted psychotherapy is when you do preparation with a trained therapist, when you have a therapist with you in the session, In the way that we approach, we're actually talking and doing psychotherapy with the client when they're in the altered state, which is one of the skill sets that we teach, how that is different. And then ongoing integration generally taking place within 24 to 48 hours. And so that's the first kind of piece, is differentiating those two. And people who come to our training programs, still some of them, especially the medical providers, might go on to just do ketamine alone practice, but at least they'll have an awareness of the therapeutic factors that go into building, helping to maximize those therapeutic outcomes.
So as you both know, and of course many of those watching this video know, there are other medicines uh, that are very effective, like MDMA, which we thought was going to get approved this year, didn't
Yes.
by the FDA. And then, of course, psilocybin, is tremendous evidence of the efficacy of that plant. And eventually, these are probably going to all get FDA approved. That's the prediction. Talk about that a little bit. How does that relate to the training you're doing? Does the training you're doing convert to those or apply for those as well? Signi, let's start with you.
Sure. The short answer is yes. I mean, both Sandy and I have backgrounds in multiple medicines. And as I spoke to earlier, we have this training program designed in its current form around use of ketamine, really for the reasons I said. It's what's legal, and it's also what everyone's going to be using. But the principles that we teach are actually designed to be applied to any psychedelic. Like often in our lectures, for example, we'll say, we'll be teaching a concept and we'll say, if for ketamine, it's such and such. If you're using other medicines, it would be like this. But the curriculum is designed to also prepare people to do MDMA assisted or psilocybin assisted psychotherapy once those are legally available for people to kind of bring into their practices. And because we don't know exactly when that will be, the idea is to create a curriculum where they all have all those skills when they're ready without having to come back for additional training. Um, we don't we don't say that all the medicines are the same. That's not what we believe. But there is a sort of functional piece they have in common, like this thing that you often hear that each of these medicines can open sort of a doorway. Really, what it is a doorway into accessing some deeper or unconscious part of yourself. You can think of it as the spiritually connected part of yourself. You can think of it as the layers of your own unconscious that have a kind of wisdom that you can't consciously access. I mean, the way we think about what that is sort of up to the listener, right? But each of these medicines can open that access for you. And ketamine is equally efficacious in that way. So ketamine opens that door just as well as psilocybin or MDMA do, even if the quality of the experience does have differences. And so the depth and breadth of the types of psychedelic experiences that people have with ketamine do parallel psilocybin and LSD
Mhm.
and ayahuasca, actually. MDMA is almost a slightly different thing.
Yeah.
Ketamine can mimic MDMA in what we call psycholytic dose ranges. And we've had a lot of MDMA experts come through our training and verify that they feel that as well. And so ketamine's quite flexible. It has the ability to be MDMA-like, and it also has the ability to be more LSD or psilocybin-like. And so we are positioning ourselves to be training people on those other medicines as soon as we are allowed to. And of course, we're hoping for that as well.
So
And
Sandy,
I would
did
add
you want to add
that,
something?
yeah, there's a super interesting piece that seems to happen too, which just kind of begs the question about the impact of set and setting and the impact of the relational component. Because when we do our training retreats, we do the second day as a group-based experience that has a very ceremonial feel. And people come out of that feeling that there were a lot of similarities to plant medicine type ceremonies, yet using ketamine. So I echo what Signy said, that there are significant qualitative differences. And yet it really does just bring up the kind of macro question about the role of, the intention, the container, the way that it's held, the role of the therapist and the guide and the facilitator and the group itself. And so we're really tracking those things really carefully, and we believe that they are of central importance to all medicines. And we use ketamine, but yet we really do find that there are some similarities that emerge, particularly with repeated use.
Yeah,
I
I
think
think
I've heard Margaret, and I don't think she takes credit for this.
Mhm.
comment, but she often says that these medicines have a way of loosening the rigidity of thinking,
Mhm.
rigidity of,
Yeah.
and it does seem to have that effect. How can people get a hold of you, Signy, if they're interested in your training or they're interested in treatment at Concierge? And by the way, I'm going to put links to both websites in the description.
Yeah, great. Thank you for that. People who are in the region in the Southeast, especially in driving region, distance from Asheville, though we actually have a lot of people that travel from out of town and stay in Airbnbs and such to be, but those of you who are in the Asheville area would go on our website for concierge medicine and psychiatry is the name of the practice. And then you would get paired with a therapist, someone like myself or Sandy or one of our other therapists. And if you're interested in actually experiencing the work. For trainees who want to sort of become trained in this professionally, that information is at livingmedicineinstitute.com. And we run trainings throughout the year. We have one, coming up actually in a couple weeks, a new cohort starting, but we run them pretty much throughout the year.
Is that full, that next one?
Yeah, next one starts to the January 22nd, next cohort.
So
So
you have room for someone if they were
I
going,
think we
oh, I
have
want to do
one
this.
one
Huh?
spot.
Two.
One
Yeah,
spot?
we've got space for a therapist or a medical professional in that
Mhm.
upcoming one. That's our 16-week online level one clinical intensive. It meets bi-weekly, and then you do a medicine session in between each one. And again, that's very, very clinical skills, kind of intensively based, getting people ready for actual clinical practice. And then our next retreat is in April,
We've got
in the
a lot of medicine experiences in the intensive. Yeah.
So I have one more question and then we'll wrap
Mhm.
this up. Um, Not that I'm really thinking about doing this, but it just popped into my head. I'm not a therapist, I have some, stuff on the wall, but I'm not a psychotherapist. What if I wanted to do this and just for my own educational purposes? Would I pass the gate? Or you say, maybe not for you, Eddie.
Well, that's a great question, and actually one we get asked a lot. Thus far, we have focused on the sort of licensed professional niche, but there partly because there actually are quite a few other training programs that are working with people who are not licensed therapists, so that there is access to that. And we've focused on that partly because that's our brand, because that's just the experience we have. And the reason is our, especially our more intensive trainings. For retreats, this is a little looser. And we actually have lots of people come through retreat who are sort of therapist adjacent, and they're going to be involved in this work in various ways, but not necessarily doing the psychotherapy part. In our clinical intensives, our curriculum is just really based on a lot of assumptions that the person has existing common language around psychotherapy interventions. So we've designed it so, when we're talking to a group of therapists, we'll refer to a lot of language around therapy interventions that we are assuming that they know that language, and then we build on that in our teaching curriculum. So our experience is those who don't have a therapist background are a little bit less, they get more, they're not as, they won't be tracking it as easily. So it evolved that way because that's who I started out teaching, and then Sandy and I started out teaching, and we have such therapist specific languaging. So that's sort of the niche we fell into. Um, but we do honor the fact that there are other training programs doing this that don't that can language there's a little bit less clinically.
Well, I don't know what you
Yeah.
said, but you brought me back into focus.
Yay!
She's good like that.
Yes,
Magic.
it was all me.
Did you want to add something, Sandy?
Yeah, just, I mean, it's like we, like what Signy said is, we have an assumption that people are coming in with a therapy background, and we do take some medical professionals. So we're not teaching people how to be therapists. And that, the danger is we don't want people walking out thinking that now they know everything that they need to know, because psychedelic assisted psychotherapy is fundamentally different than facilitation or guiding. There are some real kind of overlaps,
Oh, yeah.
but there is a significant difference around assessment, intervention strategies, kind of theoretical background, understanding of the overall process that are
Yeah, we
important.
teach it because we teach a more active, like we do active therapy when people are on the medicine. An easy way to think about this is say you're working with someone with complex trauma, which, as you know, is quite common. In our model, you may actually do trauma work like psychotherapy-based trauma work interventions on the medicine. So you would need to be qualified to do that. So because we're going on that assumption and we're teaching it from that level, we're we have to assume that you actually know how to do trauma work before we teach you how to do trauma work on medicine. So, and that's a difference between us and some training programs where they're teaching you more basic skills, like where you don't, for example, if someone's having a flashback and you need to do a trauma work intervention, they're not necessarily having that expectation. So it's really like, are you looking at this work through a psychotherapy lens or a facilitation lens, both of which are healing, but they're like slightly different skill sets.
Oh, yeah. Know your scope of practice, stay in your lane.
Mm.
What question should I have asked that I didn't, either of you?
Ooh, I got a good one. On our kind of tagline, is the appreciation of the ancient wisdom pieces and the mystical elements. And that is also something that's really important that we bring to this work. I think Signi kind of alluded to it, and we're looking for people who are interested in feeling the call and have done their own work. But, we are really like Western trained, scientific, credentialed providers. She's a psychiatrist. I'm a psychologist. We have many years of experience, but we also have a real appreciation for the ceremonial aspects. We both have rite of passage study and kind of, earth medicine and shamanic tradition study. And so really kind of holding an awareness of the fact that those are pieces that also very much inform this work. And so really just that integration, which we've mentioned, really is very much a piece of who we are as humans and professionals and the Living Medicine Institute in general. So you get both sides of that. We don't teach this necessarily. We have other people sometimes who come in and teach those things, and people can get that, but we do hold an appreciation and kind of are very curious and in inquiry about those kind of core elements.
And we honor that in our own personal philosophy toward the work, each of us. And so it kind of informs the way we teach even if it's in the background.
Yeah. I so love hearing that. It's so important to honor the tradition, how these medicines have been used for millennia. Maybe not ketamine
Well, I mean,
specifically, but
yeah.
right, the whole process.
I'll say
Yeah.
one thing, like given that we are, as Sandy said, pretty clinical. We're like doctors and PhDs in this clinical, like we just said all that. We train clinical people. And also we do believe that you can't really do this work without permission
Yeah.
from something greater than yourself. And that's sometimes described as the permission from the medicine in a lot of settings. You're probably, as you know, or the permission of one's guidance, one's own guidance, or something. There's something there. And so, that even though we're in the sort of three-dimensional clinical Western world, we do believe that call, when we spoke about a calling earlier, that calling comes from something that is not just somebody just wants to do it because they think they want to do it. So whatever that is, that's something that we do have a reverence for.
I really get that. I feel that. Yeah, it's real clear. Well, thank you both so much for doing this. This is valuable information. The work you're doing is tremendous. It's timely. And I know it's just going to continue to expand and impact. I believe these medicines, this is my thing. I believe this is the next mental health revolution.
Yeah.
How to use expanded states consciously for healing and transformation. And you're part of this. And thank you for doing this.
Well, thank you for doing it as well. And thank you for spreading the word and for the work that you're also doing in this space,
You're
right?
welcome. So
I
as I
love how
mentioned earlier,
multifaceted this world is right now.
oh, it is very much so. So as I mentioned earlier, the links to both Concierge and Living Medicine Institute are in the description. And I invite you to go to those websites and learn more. And if you have any comments, if you have experience, please leave a comment. We love it when you give us thumbs up. And if you want more videos like this to show up in your feed, you need to subscribe, folks, and hit that little bell so you get notified when future videos come out. So again, thank you for being here and thank you for watching.
All right. Thanks, Ed.
Mm-hmm.